Hello, my name's Adrian Richards. I'm a consultant plastic and cosmetic surgeon and the surgical director of Aurora Clinics, and I specialise in inverted nipples and the correction of them. So this is part 2 of a video I've done answering questions about inverted nipples, and I'm going to run through a few more that I'm frequently asked at this stage. So one of the most important is, will I be able to breastfeed? How will they change in pregnancy? Well, the cause of inverted nipples is tight ducts. Okay, so if you're a grade 1, that means the nipple comes out sometimes and stays out. You may be able to get away with just a sort of lengthening of the ducts and possibly the nipplet suction device. However, if you're a grade 2, that's the nipple comes out, goes straight back in again, that's a 2. 3, the nipple never comes out. I think it's very unlikely that surgery will be successful unless the ducts are divided, because it's the ducts that are causing the problem, causing the inversion. So the answer is, after surgery, divide the ducts, you will not be able to breastfeed. And this is a very important consideration, if you are, thinking about breastfeeding, following the operation. The thing to remember is that only some people with inverted nipples can breastfeed. So about 50% of patients, in my experience, with inverted nipples can breastfeed, and the more inverted the nipple, the more likely you are not to be able to breastfeed. Okay. Next one is, will it be painful afterwards? Well, it's not that painful afterwards. I would describe it as sort of mild discomfort after. They feel a little bit sore, sometimes a little bit bruised. Normally just paracetamol or simple analgesia like Nurofen is absolutely fine following the procedure, and we normally will give you some of that, or give you instructions on exactly what to do after the operation. If you come from a long way away, there are a lot of girls from abroad or from different parts of England, often they'll change their dressings themselves a week afterwards. So you can remove your dressings, and if you have any concerns, email us, talk to us, send us photos, and we'll of course be happy to see you. But if it's more convenient, if you come from a long way away, we can do a remote consultation, so we can talk to you either via email or in person. You can forward me photos, which I'll be able to have a look at the exact type of inversion, discuss that with you, and come down for the treatment. And then if everything's okay, we don't need to see you afterwards. So really, sort of one-stop shop, for this. Another question is, can I have operation on the NHS? Absolutely. In some cases you can. It depends in the region you work. So in some regions the NHS are much stricter than others on what is allowed and what isn't allowed. The best thing to do is really go and visit your GP and ask them to their advice, and they can always write to what's called the PCT, the Primary Care Trust, to ask their advice. And the other thing is about my technique. Why is that better than others? I don't know. It's a very simple technique, really. Other people use a variety of techniques involving scars around the bottom of the areola, flaps of tissue to hold the nipple out. Some people even put sort of bits of cartilage in the nipples. I don't think that's necessary. I think the secret really is to divide the ducts thoroughly and put the temporary stitch at the base. So I think my technique works really well. It's under local anaesthetic, minimal discomfort, minimal recurrence rate, and minimal scarring, because the stitching is inside the nipple. So I hope that's been useful and informative. If you've got any questions you'd like me to answer, please email us, and I'll be happy to do that. It's a very, very common condition, inverted nipples, affecting 10% of the population to a varying degree. The important thing is you're not alone with it. Lots of people have it, and there is a solution. So thank you for watching the video. Please feel free to get in contact with us either by ringing us or via email at info@aurora-clinics.co.uk if you feel we can be of help. Thank you.